Hi everyone, welcome to another GCSE physics video by SMARTPATHTUTORING. This is about uses and risks. There are risks to using radiation. Radiation can enter living cells and ionize atoms and molecules within them. This can lead to tissue damage. Lower doses tend to cause minor damage without killing the cells. This can give rise to mutant cells, which divide uncontrollably. This is cancer. Higher doses tend to kill cells completely, causing radiation sickness, leading to vomiting, tiredness, and hair loss if a lot of cells all get ablated at once. Gamma sources are usually used in medical tracers. Certain radioactive isotopes can be injected into people, or they can just swallow them, and their progress around the body can be followed using an external detector. A computer converts the reading to a display showing where the strongest reading is coming from. One example is the use of iodine 123, which is absorbed by the thyroid gland just like normal iodine 127. But it gives out radiation, which can be detected to indicate where the thyroid gland is taking in iodine as it should. Isotopes which are taken into the body like this are usually gamma, never alpha, so that the radiation passes out of the body without causing much ionization. They should have a short half-life, so the radioactivity inside the patient quickly disappears. Radioactivity, treating cancer with radiation. Since high doses of ionizing radiation will kill all living cells, it can be used to treat cancers. Gamma rays are directed carefully and at just the right dosage to kill the cancer cells without damaging too many normal cells. Radiation-emitting implants, usually beta emitters, can also be put next to or inside the tumors. However, a fair bit of damage is inevitably done to normal cells, which makes the patient feel very ill. But if the cancer is successfully killed off in the end, then it's worth it. You have to weigh up the risks and benefits. For every situation, it's worth considering both the benefits and risks of using radioactive materials. For example, tracers can be used to diagnose life-threatening conditions, while the risk of cancer from one use of a tracer is very small. Whilst prolonged exposure to radiation poses future risks for comparing the risks with different medical procedures and causes many side effects, many people with cancer choose to have radiotherapy as it may get rid of their cancer entirely. For them, the benefits outweigh the risks. Perceived risk is how risky a person thinks something is. It's not the same as actual risk of a procedure, and the perceived risk can vary from person to person. Thank you for watching.